Okay, so let's take a look at this. Now this is, important for us to know, but also it's a real critical issue, I think, for our patients. And this is especially true for parents that have kids that may be considered for psychiatric medication treatment because, understandably, parents are really afraid about drug abuse. And there's a lot of significant misinformation out there about psychiatric medications and that sort of thing. Okay, first off, there can be fancier definitions to this, but what this really boils down to is the difference between addiction and dependency. Addiction is where the person is getting a buzz. Okay, it's there's reward, there's euphoria of some kind, and they continue to use the drug despite the fact that it's interfering with their life, like with their marriage, their work, or their health. Okay. Dependency is where a person adapts to the presence of a drug in their system. And so this is not something that develops after a few days typically. Many of these drugs, it takes 4 weeks, 8 weeks or so of being with the medicine all the time. And so the body makes adaptations. And part of the adaptation is that some of the side effects begin to go away, which is good. Okay, but if you discontinue abruptly, cold turkey discontinuation, then you can have withdrawal effects. And that is really what defines dependency. Now, some people will talk about being dependent on a drug to prevent them from going back into panic attacks or going back into depression. And I think there's a lot of moralizing about this, largely from people who've never been there before. But when somebody's been through a couple of major depressions, they and their family have lived through absolute hell, and they say, I want to stay on the antidepressants even though I have the option of going off because I just don't want to do it again. I think it's tempting for many people who don't get it to say, oh, but you're dependent on the drug. Well, I would liken that to somebody who tells a diabetic, oh, you're dependent on insulin. That kind of dependence, that is not about drug seeking, that's not about getting high, that's not about euphoria. It's about trying to feel normal. Okay, so potentially habit forming and potentially a source of addiction are these two categories: stimulants and benzodiazepines. All right. Now, it's estimated that 13% of the population is at risk for developing some kind of addictive disorder. So the base rates are relatively high. There's a large number of people that, well, I'm stating the obvious, but they've been having serious depression or anxiety or what have you, and they get into alcohol, especially alcohol or marijuana use or abuse as self-medication, which I think it really is distinct from those that have a more sort of primary substance abuse problem. It turns out, as we'll see, I'll show you data, that in ADHD kids and adults, they don't abuse stimulants. In fact, they don't like them because it takes the edge off of aliveness and other reasons. Okay, the vast majority of people that use tranquilizers never abuse them. Again, I'll show you data later. But absolutely, these two groups are potentially substances of abuse and should be avoided like the plague if there's been a history of alcoholism or other substance abuse. No evidence of addiction potential, okay, all of these. However, many of these you can have dependency. It's very true with the antidepressants. With antidepressants, with every one of them except Prozac, if you've been taking it for 3 or 4 months and you stop abruptly, you can have discontinuation withdrawal. It's not dangerous, but it can be very unpleasant. The excuse me. The one exception is Prozac. Prozac had, and this is a useful bit of information to keep in mind. Prozac has its main metabolite gets eliminated from the body very gradually. It takes actually 6 weeks to completely get eliminated from the body. And a lot of these drugs, within 5 days, the drug's totally out of there. Okay, so if you stop Prozac abruptly, you'll hardly even see a fluctuation in blood levels for at least a week. So it has a built-in gradual taper. Okay, but all the others potentially can have some dependency. And the problem comes with our clients being unclear about the difference between dependency and addiction. All right. Now, Wellbutrin, antidepressant, also used for treating stop smoking. Okay. It is possible, if you're very desperate, that you can grind up Wellbutrin and snort it and get like a very mild buzz. Very mild. What?
It's very popular among the prison population, so they took it off their formulary. They snort the wellies, the Wellbutrin, and they take the Seroquel. It's their drug of choice, so they're off the formulary.
Yeah, and that's really unfortunate. They should give Wellbutrin in liquid form to people in prisons, because a lot of these people have ADHD. Wellbutrin also treats ADHD. It treats depression. It has the lowest side effect profile of any of the antidepressants. And I think that the fact that they don't go to using liquid Wellbutrin is punitive rather than clinical. Okay. Anyway, but you will hear some people say, "Well, you can abuse this," but if you just swallow this stuff, people don't get high on this. You got to snort it. Okay. Now, the two that you can take for months or years and then just stop abruptly are Buspar and Provigil. No dependency there. You can quit cold turkey.